good evening, everyone. Welcome back to You and Your Health. We're so excited that you're able to join our program this evening. My name is Enrico Roberts Hilton, in case you haven't watched the program before, and my co-host is Dr. Edward Suman. Dr. Eddie is getting our guests ready and backstage and will be joining us shortly. So before we get started this evening, we'd like to thank our last guest, Dr. Charlotte Campbell, the joint oncologist from Mestar Health, Washington Cancer Institute, for leading our discussion last week on cancer genetics. In our culture, we tend to shy away from topics related to cancer, but knowledge, as we all know, is power. The more we know, the more we can be proactive in preventing cancer. So please make sure you watch that segment if you haven't already done so, and please do share with others so they too can benefit from it. If you're watching us right now, I'm going to ask you to please send the link to at least 5 people who are not members of our church so that they can also tune in to this evening's discussion. So we're going to get started with our this evening's discussion on medical malpractice, also known as medical negligence. I know some of us watching this program has mentioned to ourselves or others, I wish I could sue this doctor or nurse for what they did to me. So this evening, we're going to find out whether you can actually do that, whether you have a valid case. Luckily for us, we have one of our own members, an accomplished lawyer and medical doctor. I'm speaking of one and only Dr. Thelma Wright, who will help answer our questions this evening. Dr. Wright has made several appearances in the news media channels, including ABC, Fox 45, and WBAL. So Dr. Eddie and I are so excited and privileged to have her join our little program. A little bit about our guests before we get started. So Dr. Thelma Wright is a Juris Doctor and a board-certified anesthesiologist. She's a medical director of the Pain Management Center and an assistant professor at the Department of Anesthesiology at the University of Maryland School of Medicine. Dr. Wright obtained her bachelor's degree in biology from the University of the District of Columbia and her medical degree from Howard University College of Medicine. She completed her fellowship in primary care medicine at Howard University Hospital and her residency in anesthesiology at the University of Virginia, followed by a fellowship in anesthesiology pain medicine, also at the same institution. Dr. Wright obtained her law degree from the University of Maryland School of Law and is a member of the Maryland Bar Association. She has received countless of honors and awards throughout her career and has been rated top doctor for pain management specialist in U.S. News and World Report, as well as Washingtonian Baltimore top doctors. Dr. Wright has authored and co-authored numerous of peer-reviewed articles and book chapters and has, as I mentioned, has made several appearances on news media, including ABC, Fox 45, and the list goes on and on. She has also been invited to numerous speaking engagements, both here in the United States as well as Ghana, and is a member of several professional associations. So let us welcome our guest, Dr. Thelma Wright.
Thank you for this wonderful introduction. I thought you were talking about somebody else. Thank you. All right.
How are you?
I'm well.
Thank you for coming back again to our program.
Yeah, thank you for having me. And I'm going, I know you had mentioned to the church that this was going to be an interactive session, but
Correct.
I'm going to maybe talk a little bit, introduce the topic, and then open it up for questions if anyone has any, because I figured, let me give an overview of medical malpractice.
Yes.
So I want to also say that I'm not in any way giving any legal advice today. This is more of a lecture. If you want legal advice, please seek legal counsel. But this is more of an introduction. All right, and you can see my slides, right?
Yes, at the moment.
Okay.
Yeah.
Right. So like I was saying before, this lecture is by no means constituting any legal advice or is it a practice of law. I'm just using it as a lecture. This platform is more for lecturing purposes. Okay. So, a lot of people always come up to me because they know I'm a doctor and I'm a lawyer and they say, okay, I got hurt by this doctor or this happened to me and when I was in the hospital, and do I have a case? And I can tell you, for every maybe 10 cases I look at, maybe one may get some compensation. So basically, what I'm trying to say here is it's so rare for people who think they've been harmed by the medical community to be compensated. Because to be compensated, you have to prove that that healthcare provider was negligent. And negligent is not, okay, they were negligent, they did something wrong. You have to satisfy four elements of negligence. And if one is not satisfied, you don't get compensated. So basically, you have to satisfy each and every element of negligence before you could potentially get compensated. So this slide is saying usually, there's litigation, but it's very infrequent that patients actually win. And that's because you have to make sure that that provider was negligent. So I'm going to talk a little bit about what negligence is. So another caveat to medical malpractice is not all medical errors are considered medical malpractice. So even though something bad or there was a bad outcome, it doesn't mean the doctor did anything wrong. So you could potentially be injured. You could even go to the extent of a patient dying and the doctor would not be held accountable. And that's because, there are serious complications that can occur, and it may not necessarily mean the doctor messed up or, committed malpractice or was negligent. So we have to, like, once again, I cannot stop emphasizing the fact that if you want to prove negligence, all four elements have to be um, satisfied. So medical malpractice is tort. So basically, it's kind of like when you have an accident when you're driving, that's tort law. When someone gets shot, that's tort law. Medical malpractice is the same thing. It's not criminal law where somebody gets sued or there's a cause of action and someone ends up in jail. So medical malpractice is more tort where we're trying to redress the wrong that was. Oh, I'm sorry, what happened here? I think I must have hit something by mistake. Okay, here we go. So we're trying to redress the wrong that was caused to that patient. So basically, if there was a wrong that was caused, we are trying to compensate that patient for the wrong that was caused. And basically, at the beginning of this tort law, the intent was to award full compensation. So, whatever the amount they think they lost, whether it's loss of job, loss of, monies they would have made if that tort hadn't happened, we try as much as possible to get that compensation to the patient. All right. So I like this slide, even though it's an old slide, it goes to the fact that medical errors happen a lot. So you can see here that, you have aviation deaths, which are your, airplane deaths, and then you have drowning deaths, and then you have deaths from falls, motor vehicle accidents, and you look here, 120,000 deaths, and this is from 1996 or something. So this is an old slide, but I'm trying to make the point that there are a lot of accidental deaths that happen from medical error, but they don't necessarily, translate to a doctor being sued and compensation. And that's because the medical errors may not necessarily occur because of some negligence from a physician. And I cannot stop stressing that just because something bad happened to you does not mean the doctor messed up. And actually, another thing I would like to mention is currently in 2021, 10% of all US deaths are actually due to medical error, right? High number. It is the third highest cause of death in the US. And, so medical error is about third cause of death. And then it's also very under recognized. So, a patient can get admitted in the hospital, go home, 5, 6 days later, and then somehow pass, right? But then it's so hard to tie that death to something bad a doctor did. So even though, they got discharged, everything seemed fine, they went home, they were doing okay, and then unfortunately they passed, it's very hard to tie that death to something bad that or something wrong that the doctor did. So why is medicine so susceptible? And I think it is because, for the most part, sometimes we don't even know, we're not even aware of the issues that could potentially lead to the death. And then there's this culture of silence, and I'm a physician. And so I know, sometimes, we cover up for each other, right? Something happens, you come to me, you talk to me about it. And, we try as much as possible. Of course, we have the Hippocratic Oath. We're not supposed to do harm to patients, but sometimes things happen, right? And I get called, a lot when patients, need a defense or expert or an expert witness. And if the doctor is here in Maryland, I most likely will not take the case. Because you know what, you can meet them at a conference, you may meet them around, town. So you don't want to go ahead and throw your colleague under the bus. So I would usually take a case that is in Atlanta or Florida, or I wouldn't take a Maryland case. So sometimes it's hard to find an expert witness, not expert witness, an expert in the environment where you live. So that's one of the challenges when you're a plaintiff and you're looking for a doctor to serve as an expert, especially if you're in the same state as that expert. They don't really want to go against their colleague. And then there are system constraints. Before, maybe 10 years ago, we used to work such long hours, and then they came up with the 80-hour, work week. You have doctors who go on call, they're going home, and they're tired, and they're performing
Mhm.
surgeries, long hours in the hospital, and that could lead to medical errors because of fatigue. We have decreased staff. Nursing, we have an issue finding nurses. All hospitals are actually understaffed with nurses. You have one nurse taking care of 10 patients. So that could obviously lead to issues with injury to patients. I thought this slide was quite interesting. 42% of the public report some medical error, or at least in their mind, it was a medical error. And 66% report serious consequences, such as severe pain, either from surgery or from some intervention. They also would report, loss of time at work. They're not able to go to work because of some surgery that they had, or there's disability or even death. And guess what? Only 6% will sue, right? Because
Mhm.
they don't want to go through the hassle. They're having trouble finding a lawyer who will take the case. Because the one thing with plaintiff cases, and to actually tell you, I don't want to get a whole slew of calls after this lecture. I don't usually do plaintiff cases. I try to defend my doctors. So, I went to law school because I wanted to defend my colleagues. So for me to take a plaintiff case, it has to be really a slam dunk, where it's
Mhm.
so clear that the doctor was negligent, it was egregious, it's so obvious, and I've had I would take a case if I think I'm going to win this case, but it's so rare for you to even say you're going to win the case, because you don't know, you could lose on a technicality. And another thing is, plaintiff lawyers do not usually charge you. They will charge you after they win.
Mhm.
So they're not going to take a case if they don't think they can win it, because guess what? They're paying for everything. So if they don't win it, they have to, eat the cost.
Right.
So you want to take a case on, you have to be pretty much 80 to 90% sure you could potentially win this case, because then you end up spending all this money and then you don't win the case. So only 6% of patients actually sue their doctor. All right. And this is another slide that, goes to confirm the slide before, where you may have 1,000 injuries, medical injuries, and then there may be about 280, which was due to negligence, and only 36 will file a claim. And then unfortunately, they may sit on the case, and then by the time they turn around to actually try to sue, the statute of limitation has gone by, and so they can't. And so basically, where do these numbers come from? Why might they be overestimated? I mean, and that's because sometimes it's hard to determine what the cause of death is. The cause of death could be very well be from the fact that, the patient did not follow instructions when they got home. And so it's nothing the doctor did. We told you don't do this, and you went home and you did it. And you got that injury. It's not the doctor's fault it happened. Um, Also, it could also be because we have a hard time finding these experts to take on the case because they're in the same state as the doctor. You can't find a reviewer to look at the case. We're busy. Sometimes I get calls, can you look at this case? And I'm like, I can't. It's 1,000 pages. I just don't have the time to look at these cases. And then you also want to make sure that you are in agreement with other doctors because you don't want to go to court and look stupid, right? So you want to make sure you have all your T's crossed, your I's dotted, and that you're absolutely sure that this case is going to be you're going to be successful with the case. And then obviously you want to make sure that you are assessing the case holistically and that you're not leaving any stones unturned here. All right. Now, with patients who are having a hard time or they have some reluctance in suing their doctor, I think it's because they don't have the knowledge or the requisite knowledge, and also they're afraid. They're afraid, if you sue your doctor, are you going to be able to go back to see the doctor? You probably won't. I can give you an example of a patient who sued a physician who worked in my practice, but the physician left. And I actually was taking care of this patient. We had a great doctor patient relationship, but the doctor who left was the one who injured the patient. And the patient sued and made money, got some money. But guess what? I had to break that doctor patient relationship. They couldn't see me anymore. And the patient actually liked me, but they couldn't see me anymore because they had sued and they had made money. And so they had to go. And they had a hard time finding another doctor to take on the case. So sometimes patients may get a bit scared to go ahead and sue their doctor who they have, a decent relationship with. I'm sorry, I think I went backwards. All right. So why do people sue the doctors, right? Sometimes they sue because someone has told them, you know what, you should sue that doctor. The doctor screwed up. Go ahead and sue that doctor. Or they think they're going to make some money. So they need the money, or they think that doctors are covering up, or, especially when it happens to children, something bad happens to a child. Or, the child has no future. They can't live a fruitful life or a productive life. They needed information and they weren't getting the information, so they'll sue, or they want revenge. They want that doctor to, lose their license, so they'll go ahead and sue. So those are some of the reasons that a patient may sue their doctor. And now, on the flip side, some patients will not sue because they like their doc. And when I give this lecture, I always tell, and I usually give the lectures to other doctors. I think this is the first time I've given the lecture to the layperson, and I tell them, patients will not sue you if they like you. So if a patient likes you, they won't sue you, even when you mess up. And, knock on wood, I've been doing this for about, 16, 17 years, and not yet. And that's because I try as much as possible to have a great relationship with my patients so that if I do mess up, hopefully they'll, forgive me for my mess up. you know um and like I said, you have to establish negligence, and negligence is really hard to establish because you have to satisfy the four elements. And what are the four elements? There has to be a duty. That doctor has to have a duty. The doctor has to breach that duty. There has to be an actual and proximate causation, meaning you have to be able to tie the injury to what the doctor did. And if you can't tie it, you don't get compensated. And then, of course, there has to be an injury. So, what is duty? So, duty is to provide a standard of care that other healthcare providers in the same environment will provide, or in the same set of circumstances. So, for instance, if I do an injection and the patient somehow stops walking because I hit a nerve or something, that is an adverse effect from doing an injection. However, if I didn't prep properly, I was negligent in prepping and the patient got an infection, then that's negligence, right? Because I didn't prep properly, the patient ended up with infection and the patient lost their leg. That's negligence. You can tie the fact that I didn't prep properly to that infection that caused, the leg to be amputated or whatever have you. What is duty? So duty is what another prudent doctor would do under the same circumstances. Is also what maybe the state board requires us to do. There are also some national treatment guidelines that are required of us, and then of course there are some institutional guidelines. So all these things have to be followed and adhered to. Now there's also expert testimony. Now, the one thing people don't realize is you have to pick your experts. You can have a very knowledgeable doctor who would be an expert. They know, they pass their boards, they're smart. However, they go to court and the jury hates them. If the jury does not like your expert, you're probably not going to win. Or if your expert is not believable, or they think your expert is lying, you're not going to win. So, there have been cases where, I have shown up in court, and I just look at the patients, and, I'm not the patients, the jury, and I make sure that I can bond with them. I look at them, I don't blink, I don't look elsewhere. I'm looking at them, and I'm trying to appeal to the human nature, right? To
Mhm.
their humanity, to say, look, believe this person, believe that doctor. They really did not intend to, they were not negligent. And sometimes, even when it is quite possible the doctor was negligent, you end up winning that case because the jury believed your expert. So, picking your expert is also key. Now, like I mentioned before, the healthcare provider has a duty also to provide informed consent. So if you're going to do a procedure, whether it's surgery, or some intervention, you want to make sure that you break that consent down to a level where this patient understands what you're saying. Because if the patient doesn't understand what you're getting ready to do and they go ahead and sign something, they can blow up that consent. They can ask they can ask the lawyer or the doctor, what level of education does this patient have, and why would you write this language or
Mhm.
explain this language in this high level format where quite well this patient is not going to understand. So you also want to make sure that when you're getting ready to do a procedure or some intervention, that your patient understands what you're ready to do or what you're going to do. Now, what is the breach? The breach of your obviously is a deviation from the standard of care. So if you deviated from the standard of care, then that doctor breached that duty, and that's one of the elements of negligence that we spoke on. And then I talked about the third element, which is being able to prove causation. So what is being able to prove causation? So we use this but for clause, meaning the patient will not be here but for the doctor's negligence. Okay, so this wouldn't have happened to me if Dr. Wright hadn't done this. I was going about my business, doing everything like I usually do. Dr. Wright did this injection. I ended up with this, and that's why I'm here today. So you have to be able to tie what Dr. Wright did with the injury. And if you can't tie it, then we got a problem. You're not going to be compensated. And then there's also the fact that, that physician has to be able to foresee the potential of injury happening to that patient. So I'll give you an example. If I'm getting ready to do an injection and the patient tells me I'm on a blood thinner, patient tells me, I did not stop my blood thinner. And Dr. Wright, being the cowgirl that she is, like, yeah, whatever, I'm going to do this injection. The patient is going to be fine, and I do the injection. And the patient gets what we call an epidural hematoma and
Mhm.
ends up losing all sensation in their lower extremity and they can't walk. That's a problem. I foresaw that there was a possibility that doing the injection will cause an issue, and I still went ahead and did it. That I can, you can tie it. All right, so I'm going to give an example of a case. So you have this patient who comes into the hospital, gets seen by a nurse practitioner. Patient has a remote history of ulcer. You know what an ulcer is.
Mhm.
When you take anti-inflammatories like ibuprofen and you're allergic to, you're likely to get an ulcer. The physician reads that nurse practitioner's history, starts aspirin therapy. Unfortunately, that patient did not mention that they had an ulcer. So the doctor did not know, right? And started the patient on aspirin. The patient ended up, I guess, getting a GI bleed. But guess what? The court found that the doctor was not negligent because the
Mhm.
doctor did not know the patient
But
had
you
an
had an
ulcer.
ulcer, yeah.
Right. And the patient did not mention it. And actually, that has happened to me in the past
Yeah.
where a patient comes in to get an injection. I ask, are you on a blood thinner? She goes, no. I said, what are the medicines? They failed to tell me about the blood thinner. And I go ahead and do the injection. Well, nothing really happened. But if something had happened, it wouldn't have been my fault, right? Because
Mhm.
I did not know. I mean, I think some doctors think they're God, but I'm not. As if I would not know that you're on a blood thinner. So I cannot be, I cannot be the cause of an injury that I wouldn't know what the patient's medical history was or what their medications were. So you don't have a case if there's failure to prove that the injury or death was a result of violation of standard of care. And I think that's the one thing that I'm trying to get across to my audience today is that if there is no violation of standard of
Mhm.
care, there cannot be compensation. All right. So you have to prove the injury. And then how do you prove the injury? You got to show medical bills. You got to have an expert testimony. You got to have evidence of the pain and suffering. And that is why, I see a lot of patients who come in, they had an accident. The lawyer says, go for physical therapy, go and see the doctor, do this, do that, because they're trying to make a case. And, I know what they're doing and I see them and I just kind of smile in my head because I know where they're going with it because they want to prove that, look, I've been injured. I saw Dr. Wright a million times. He gave me this medicine. It didn't work. That didn't work. That didn't work. That didn't work. And I have all these medical bills. And so now you got to pay me. And, so you have to have some evidence of going to the doctors. You have bills. But if you don't have a bill, then you weren't injured, right? So,
Mhm.
you have to show all of that. Now, this slide is only speaking about Maryland, not other states. So
Okay.
in Maryland, you are able to get economic damages and non-economic damages. Now, your economic damages are, cost for, the past medical treatments that you got, the present, and then the future. So, for instance, I'll give myself as an example. So let's say I got injured, they cut the wrong leg, that's obviously negligence. So
God
they cut the
forbid.
wrong, they cut the wrong, and it's been known to happen. They cut the wrong leg, and I've had all these before I sued and got to court, and judgment was made. All the medical bills that I accrued before court would have to be paid for, and of course the ongoing cost of medical treatment has to be paid for, and then future treatment has to be paid for, and my loss of income. So let's say I make $1 million a year, which I don't make, by the way, but let's say I did. And I'm not going to be able to practice again. What do? They are going to multiply let's say a woman like myself will live to be about 80. They go, and I'm 52 right now, they're going to subtract 80 from 52 and multiply it by that $1 million and say,
Mm,
what, this is what Dr. Wright would have made if she hadn't gotten her leg cut off.
mm,
So they do the non-economic damages, and economic damage, and then they do the non-economic damages, and which is the pain and suffering, the disfigurement if you're married, loss of consortium if you're not able to have, your marital, the sex and all that that goes along with it, or going out or going on vacation. They take that all into consideration. The only thing though is there is a cap in Maryland, so you can't
mm.
go above the cap, unfortunately. So I believe in 2021 it's about 845,000. So you can go beyond that. So that's all you get. But in other states, you can get more than that. There's no cap. So there are other causes of actions when a patient dies, especially, and that survival action. So the husband can sue, or the parents can sue, or the kids can sue, and so basically, survival action is filed by the personal representative of the deceased to claim for damages on behalf of the deceased, and including the pain and suffering prior to death. So if a patient died, after a long, drawn out, painful sickness, you're more likely to make more than a patient who died like that. Because if there wasn't any long, drawn out pain and suffering, then you can't really prove that there was pain and suffering. And then there's this wrongful death, where the family of the deceased will actually you know, file a wrongful death suit for, the loss of support. So, for instance, I had a case of a patient who passed for, secondary to some illness. And, basically the woman was working, making money, helping husband to take care of kids, pay for college, this, that, and the other. So you have to put that into the calculation, because now the man is left on his own, doesn't have the monies that come in from the wife's salary. So you have to take that into consideration also. And this is the last slide because I wanted to
Okay.
do more questions than anything. So in Maryland, a medical malpractice lawsuit cannot be filed in court unless there's a medical expert who signs a certificate of merit explaining that there was a violation of standard of care that resulted in an injury. And so that's not easy to find,
Mhm.
because when you sign that, you're putting your reputation, your license, everything on the line. You know what I mean? So you got to make sure, as an expert, you are absolutely sure that there was a violation of the standard of care. Also, plaintiffs can file suit against the doctor or the hospital. Now,
Mhm.
it's better to go for the hospital, right? Because they have the deeper
Mhm.
pockets, because the doctor, how much do they don't really have that much. And then they, of course, they tie it up in, personal. You can't really go for the personal. You kind of have to go for the malpractice insurance. So you
Mhm.
most patients will go for the hospital. Now, if a doctor works on their own, then of course you're going for the doctor. And there are situations where some doctors have won the lottery and then they quit working because they don't want the patient they don't want a patient to sue them and get those lottery funds. So you win a big lottery, like you win billions of dollars, you better stop working as a doc because the patients will go for it. Some cases will settle because sometimes the defendant does not want to go all the way to court. So sometimes it's easier to settle, because you don't have to go to court and pay all these experts. And then plaintiffs may, if a plaintiff's case is not very straightforward or slam dunk, they may want to settle, or they may want to settle because they don't want to run the risk of going to court and losing the case. Most cases are litigated in circuit court, and trials are held in front of the jury. The jury decides if there was negligence and also decides how much money to award the plaintiff. Um, like I said earlier, that plaintiff cases usually work on a contingency fee. If you go to a lawyer and you are the plaintiff and the lawyer says you got to pay me, you better go find another lawyer, because most lawyers will say, will do the case and then compensate you, or pay you afterwards, or take their cut. The only problem with that is, I believe the lawyers usually would take about 33%. Some lawyers
Mhm.
will take 40, and then even though they're taking 40, they'll come back and say, oh, you got to pay for the photocopying and the driving and the this and the that. So they end up giving you this whole bill, and then your 60% ends up being like 45%,
Mhm.
because they're taking out every single thing they did with the stapling and everything. So you
Wow.
end up, yeah, yeah. So you end up not getting what you thought you were going to get. So I believe this is it. I wanted to make it real quick so I can get more questions
Questions.
from the audience.
Thank you. Thank you
Of
so
course,
much,
of
Dr.
course.
Wright. So, Dr. Eddie, I'm not sure if you have questions that you can post for Dr. Wright to respond to. While I'm waiting, listening to you, I have a couple of questions
Mhm.
in mind. Oh, Dr. Eddie, you're muted.
I think we don't have. You can go on with your questions, and then
Yeah,
when
I can also give
O-
examples. No problem.
Okay.
Mhm.
Okay. First, I was wondering, you mentioned in terms of physicians and insurance companies, and I was
Mhm.
wondering whether carrying insurance is required as a condition of hospital privilege of employment for physicians. So, do they have to have the insurance coverage before they actually get privilege at that hospital that they practice at?
You have to. Yeah.
You have
You
to.
have to. So for me, working at University of Maryland, the beauty of working at a university is they cover you. Obviously, they're not going to cover you for things like sexual harassment and a patient saying a doctor touched them or groped them. So they're not going to cover that, but they will definitely cover any medical malpractice. And the one thing about working for a university practice is, even when you leave or quit that job, any cases that come after you leave, they will still cover you. So that's
Mm-hmm.
what we call the tail insurance. So, I've been working for university, but if I end up leaving and someone sues me, even though I'm not there, as long as I was working there, they will cover that case.
So for how long? Like
Well,
forever or 5 years, 10 years, or
no, I mean, as long as I was working there, any case
really?
that arose from me working there, they will cover.
Okay.
They would have to cover because I was working there at the time. So they'll
Okay.
cover that. Yeah.
Okay. And he had mentioned in terms of standard of care that that the patient has to invoke the concept of standard of care. And I was wondering, as I was reading prior to you coming on, I realized that standard of care varies
It
in
does.
different states. So if something that occurred in Maryland that was considered negligent, but then another state was considered standard of practice, could then the defense use that as saying that this actually is a standard of care?
Not
Or
particularly,
okay.
because if you are in the state of Maryland and all the, the physicians will practice in a certain way, you can't go and say, well, the Alabama state, this is how they practice. We don't care about Alabama. This is
Okay.
Maryland. This is how we practice here. Because sometimes in like the remote or rural areas, they don't have as much as the stuff that we have here. So yes, maybe it may be a bit softer in those rural areas where they can let things slide because they don't have the amenities that we as bigger cities have. So, the standard of care may be a bit different. But in Maryland, or I should say, standard of care is what an individual or another physician or prudent physician will do in the same circumstances. And that is why we have what we call morbidity and mortality meetings in our department where, I think once a month we talk about cases. And okay, we don't really throw the book at the doctor because then no one want to talk about their near
What
misses
case?
or things they did wrong. So we talk about cases that happened, and then we actually dissect those cases. Okay, what would you have done differently? Would you have done something differently? And we talk about it, and basically standard of care, like mentioned before, is what a doctor in the same environment would do under the same circumstances. I actually had a case, and I think the plaintiff has appealed. The judge ruled for us. So this was not a doctor, a nurse practitioner. And nurse practitioners usually work under a doctor. And the nurse practitioner I think they're trying to take her license because she overprescribed narcotics, and I think a patient passed or died or something. And they're trying to take a license from her, and basically they're saying she was not following standard of care. However, this nurse practitioner practices under a doctor. So you can't really take a license from her without taking the license from the doctor, right? Because nurse practitioners don't usually, do things on their own. They kind of have to get the blessing of the physician. And so the judge ruled for this nurse practitioner, but now the plaintiff, or which is the state, is appealing and saying no, they should have had this nurse practitioner's license revoked because they think that she still didn't follow standard of care. But I went in as an expert, not as the lawyer. And basically I said, you know what, the way she practiced was fine. I mean, if a patient is in pain and they come in saying, I'm still in pain, and they increase the medications, you don't know the tolerance of a patient. And if the patient takes more than prescribed, we can't control that. If a patient takes more narcotics than prescribed and ends up dying or stuff, you really can't tie that, and so those are some of the nuances of medical malpractice where family members or are upset because their loved one died, and they're trying to find someone to blame, but it's hard to tie that death to negligence of that healthcare practitioner.
Okay. Dr. Eddie, do we have questions?
Yeah. So one question that came to mind was how long does someone have to duration to sue after a procedure or after visiting the clinic or hospital?
I believe the state of Maryland has 3 years. They have a statute of limitation of 3 years. However, for children, I think it's 18 to 21 years. So basically, if you go have a baby and somehow the baby's they don't have enough oxygen, and the baby comes out and has cerebral palsy or some injury, you have quite a long time to sue. But with adults, I believe the statute of limitations is 3 years.
Mm.
So if you have a case, you want to most people will wait till the very end to do that so that they have more time to get it into court and all that. So but you have to make sure once you put it in, the clock starts ticking. So you just have to be sure that your timing is right, and that you have all your ducks in a row, and you have all the information to be able to get a successful suit.
So once you file, you have up to 3 years to conclude the case. Okay.
Mhm. not
Okay.
to conclude the case, but at least to get that case going,
To get that
to
case
file the
going.
claim and all of that. Because if you don't do that, you're done. You can't do it. So sometimes, there was this patient that I actually had done an injection, and it's funny. I had given them the consent. We do these injections for patients. Actually, the patient had breast cancer and
Mm,
had a mastectomy, and so I would do these injections called intercostal blocks. Now, one of the side effects of intercostal blocks is your lungs collapsing,
mm,
right? And so, under normal circumstances, we will do one side at a time. We wouldn't do both. And I never do both. But this patient comes in, I told them I don't do both normally because if the lungs collapse on both sides, you may stop breathing. She's like, "No, I came from the Eastern Shore, Dr. Wright, please." I said, "Sure." So I did it. And guess
mhm.
what? The lungs collapsed. And she had to
Oh,
go to the ER and they had to put a chest tube in and all that. And she, her husband got upset. So I was like, oh my God, they shouldn't sue me. They shouldn't sue me. And then of course, 3 years goes by and nothing. So I'm off the hook,
yeah.
right? So thank God because they would have won, but
Mhm.
they didn't, and I
Mhm.
think that's the thing. People don't know.
Right.
People just don't know. And I think I alluded to that in the slide that, knowledge is key. Because if you don't know, you don't have family members who know, you just don't even know that you have a case.
Mhm.
And that's the issue, right? So you know your best bet. And most people who will consult, or most lawyers who will consult, will not charge you. They're not going to
Mhm.
charge you for a consultation. So you don't lose anything going to see a lawyer. The only thing is, most lawyers are not like me. They're not doctors, so they don't know. They
Mhm.
don't know whether there's any the case has any credibility or whether they're going to win. They don't know, so they have to get an expert. And so I think that sometimes what happens where some lawyers may not want to take a case because they're not sure whether they're going to win the case or whether there's a case anyway. So because I mean I do read a lot of cases where patients will come to me and say, "Hey, doctor, they bring me all this," and I'm like, "I'm not reading that. I don't want to read all that to see whether there's a case or not." So yeah,
Yeah.
it's not easy.
Mhm.
So
And mhm.
can I sue for failure to treat?
Oh, that's a good one. Actually, that's a good one. So, and then once again, I'm always going to give myself as an example. I'm a pain physician, and you have patients who come in, and I don't know how many people are listening to me, but you have patients who will come in, and in my opinion, I should preface that they could be drug seeking, right? So they come in and tell you, and I have this headache, or I have this back pain, and I have this, and nothing works for me, and only oxycodone, only Percocet, and that's what I want. And I tell them, okay, I'm going to review your case, and I'll get back with you. But then they believe that because they saw me, we have a doctor-patient relationship, but we don't
Mhm.
necessarily have a doctor-patient relationship because you came in for a consultation.
Mhm.
So I have to review, I have to decide whether I think I can take on this case. So sometimes, I will discuss the case at my usual weekly meetings with the other doctors and say, okay, I have this patient, this, that, and the other. They were fired from another clinic, and they're here asking to be on 30 milligrams of Percocet. And I don't know if I want to do that. I think they're drug seeking, and I call them and say, okay, I don't know that I want to take you on.
Mhm.
And then they threaten me. I'm going to call the board on you. And
Oh wow.
oh God, and I think as a pain physician, I'm used to that now, but they threaten you that you're failing to treat me because, and of course they use you because I'm black. I'm like, I'm black too. But yeah, so there is if there is a doctor patient relationship, then yes, you could be sued for failure to treat. But if there isn't a doctor patient relationship, then of course you can't. But however, if the patient, there are some patients who want to call their treatment, they want to tell you how to treat them. So they tell you, I don't want this, I want this. And if I say I don't agree with you, then they think you're failing to treat me. I get that all the time. A patient in the hospital, maybe a sickle cell patient, they're used to
Mhm.
being on loads and loads of narcotics. And so they come into the hospital. I get called, Dr. Wright, we have this patient, and the patient is, demanding, not requesting, demanding this drug. And I'm like, no. And of course, they want to call patient advocacy and they want to because they're saying I'm failing to treat them, but that's because I'm failing to do what they
And
want,
what
not
actually to do.
necessarily failure to treat.
Right. So a follow-up question to that, how about failure to diagnose? So particularly for primary care physicians or surgeons and things like that, do you see a lot of cases, have you heard a lot of cases that
Yeah.
patients file related to that?
Yeah. But once again, I mean, unless it was so clear that this was the diagnosis, when you show up for, I mean, the worst case, is the cancer patients, right?
Mhm.
The patient who goes to see the doctor, who, and the doctor sort of was not, kind of very cavalier and thought there was nothing going on. Only, and I have seen that case
Mhm.
happen before where a patient goes in for some complaint, doctor blows it off, a year later full-blown cancer. Those are the worst cases, because if you're taking that patient seriously, you could have
Mhm.
you know done that MRI or done that CT scan and caught it. Those are the worst.
Mhm.
But the case where you're not sure, that's kind of hard. Then you have to do all the blood work and all the x-rays, and so it depends on the presentation.
Mhm.
So if a patient comes to me with back pain, and the back pain has only been around for a week, I'm not necessarily going to go and do an MRI. That's not standard of care. Yeah, even the insurance companies are gonna not, they're not gonna pay for it anyway. So because the insurance company is like, okay, did you do physical therapy? Did you do this? Did you do this? Before they'll pay for an MRI. And unfortunately, insurance companies are now, telling us what to do. So if a patient comes in and continues to complain of back pain and tells me, Dr. Wright, I've lost 80 pounds of weight, I'm having night sweats, and they're giving me all this history, and I still
Mhm.
don't get an MRI, that's a problem, because
Mhm.
they gave me all the history. They're telling me they've lost weight. They're telling me, they're having night sweats, all of that. They never had back pain. Then, I should start thinking, could it be cancer? Could it be mets? So then, yes,
Mhm.
that definitely will be negligent. But when the history is not very clear and the patient is not a good historian, it is possible you may not diagnose it. And then once again, you got to go back to standard of care.
So we have a question there. What would happen if an injury or source of injury were not determined until after the statutory limit?
Then I guess the doctor gets off the hook,
Yeah.
right? Yeah, the
It says,
doctor gets off the hook, and it happens. It happens. I'm part of the risk management at University of Maryland, and we have cases like that where it wasn't determined till after the fact, and you can't. The patient really can't do much about that.
and I think the person gave an example as a woman not being able to get pregnant because of a mistake that a physician made long time ago. Yeah,
Well,
I read a lot of infertility cases
mhm.
related to misdiagnosis as
Yes,
well.
and what you have to be able to tie it. So once again, you have to be able to you have to be able to show documentation of the doctor saying, this, I can't help you with this, even though they could have. But if the statute is of limitation has gone, it's a bit difficult. It's a
Mhm.
bit difficult.
So,
Yeah.
since medical malpractice lawsuits are typically hard to conclude and resource consuming and emotionally taxing, would you like recommend for folks to settle lawsuits out of court, or it
So
depends on what
it
the suit is
depends.
on?
It depends. I mean, if you're a gambler, yeah, or you're greedy, yeah. So, I had a case and we won. But this was a slam dunk, okay? This is a patient who was a paralegal and he was, healthy 35-year-old, goes to work every day, wears his sneakers, catches the train, walks to work, and has a history of migraines. And she would usually go, I'm not going to mention this place, but they got sued. It was one of these urgent care
Mm,
places. Every month goes to get an injection for the migraine. And this time when she went, they gave her the injection and she just thought it was different this time. She
mm,
said, Dr. Wright, it was so different. They gave me the injection and immediately there was pain down my leg. And anyway, the
mm,
subsequent months, patient lost sensation in her leg, ended up with what we
mm,
call complex regional pain syndrome. Now, when you have that diagnosis, that's $1 million verdict. And
mm,
she had that diagnosis. And so we won that case. And that's because, she couldn't work anymore. She couldn't walk anymore. It was clear. And then the jury believed her. She was a belief. So she went all the way to court. She didn't want to settle. She didn't want to settle. But, like I said, even though she got a big, the judge ruled for a huge amount. The lawyers who were working with me ended up with most of the money anyway, because they had paid all these experts, and so they had to pay all these experts, and she was left with not much. So that's the thing. Yeah, so there's you have to balance. Okay, am I going to make a huge pay? Am I going to get a huge payout? If I think I'm going to get a huge payout, then I might as well go to court.
Go to court.
But if you're not sure, you better settle.
So if you go to court, to the circuit court, and for some reason you lose, would you be able to file for a higher court then?
For the most part,
like appeal.
You could appeal, but then, well, your law, who's going to take that? Is your lawyer? Your lawyer may not. They've already spent all this money. They may not. They may just say, go find another lawyer to do that. I'm not going to do it because So most plaintiff lawyers have to have a whole lot of money sitting on the side to take on a plaintiff case, because that plaintiff does not pay a penny. And if they don't win, the lawyer eats that money. The patient walks away. So you have to be quite confident that you're going to win the case to take the case.
So I know, like, typically people term doctors or nurses as healthcare providers, especially in a medical malpractice case. And I'm just curious, I've always been curious about this, whether the extended care folks, so for example, nursing assistants, patient transporters, home health aid, are they classified as healthcare providers when it comes to such cases? Or
you mean you're talking about the legal cases?
Yes.
Yeah, I mean, it's rare for the ancillary staff to be sued. It's kind of rare. I mean, unless you can directly, for instance, if a patient transport person was pushing the patient and the patient fell, that's the hospital, not that patient transporter, right? They're going to go for the hospital, or, the patient falls out of their bed in their room, that's still going for the hospital. You're not going to go for the MA or the patient transport. No. So for the most part, when people get sued, it's the nurse practitioner, it's the PA, it's the doctor. Nurses do get sued, especially if, the nurse was given an order, go ahead and give whatever, epi, and then you gave something else, you could get sued. But then once again, it would be the institution that nurse works for.
So does the institution select their own defense attorneys, or would the person who's tied up in the lawsuit, like the doctor or the nurse, select their own team, or how does that work?
Yeah. So, I can speak for University of Maryland. So we have a group of lawyers. So we have, our risk management, we have general counsel. So when we have a case, or, the board writes to one of us about something a patient has complained about, they will represent us. Now, when it's a case that goes to court, they end up using outside, but they pick those lawyers, because they know the lawyers. So they will pick the lawyer, because they would not necessarily go to all the, court, all the cases, so they will pick an external group of lawyers to take on a case, especially if it's like an OBGYN case and they know a lawyer or a group of lawyers who are good at OBGYN cases, they will pick those.
Okay. Dr. Eddie, do we have any questions before I let Dr. Wright go? I know we have a program at 8 o'clock.
I think we've exhausted most of our questions.
I guess, nobody has hurt our church members. So that's
They're on, but as I said before. Oh, okay.
So we cannot sue preemptively for denial of service. I want a full body scan, but doctor says don't need. It might open it. Yeah, I mean, the patient is not a doc. So if your doctor, in their medical opinion, does not think you need a particular procedure or scan, they can say, I don't think you need it. But guess what? You, the patient, have the autonomy to pick another doc. I tell them all the time, you can find another doc. And sometimes I don't understand patients. You have the autonomy to pick another doctor. If your doctor does not want to get the scan, you have the autonomy. If I don't think you need a scan, go find a different doc who will do it.
Okay.
Yeah,
Dr. Wright, thank you
yeah,
so
you're
much.
welcome.
Thank you
You are
for
very
coming,
welcome.
and thanks for
Yeah,
this
and
excellent
if people have
presentation.
questions for me, they can, I guess
They can
email
send
me.
it through, yeah, they can send it through us, and then we'll forward it
Yeah,
to
just
you
don't send
via
me a
email.
1,000 pages.
No.
It's not gonna happen.
No, we have an email link to this program that we send all questions to, and then we
Awesome.
then forward it to our speakers on the program. So
Yeah,
thank you so much. I'm
yeah,
hoping and praying that you come back next year, which
yeah.
is
I'll
around the
try.
corner.
Yeah, yeah, yeah. I know you wanted to hear about arthritis, so I
Yes.
was like, yeah, I know. So
I still
I
have
think
you
I'm
on the
sure everybody
calendar
has
for
some
that.
knee pain. Yeah,
Yes.
for sure. I'll try and talk about that.
Okay.
Take
Well,
care.
have
Thank you
a
very much.
wonderful evening,
You
and
too. Thank you.
great holiday as well.
You
Thank you so
too.
much.
Yeah.
Okay.
Bye bye.
Bye bye. Uh, so, family, we hope this segment was informative to you and your family. As always, please do share the link. I know most of you did not ask questions, but certainly take a look at the segment again. And if you have additional questions, you can send it to Dr. Eddie and myself. Dr. Eddie and I will be back next week with our special guest, the very Reverend Dr. Joseph Osei, Dr. Joseph Osei, on a discussion on Christian perspective on COVID-19 vaccination. This is a timely discussion, especially since we now have a new variant of the COVID-19 of the COVID-19. So anyway, as always, please feel free to submit questions to emcuandyourhealth@gmail.com. Again, that's emcuandyourhealth@gmail.com. We are still in a pandemic, so please continue to stay safe. Wash your hands, wear your mask, and social distance. If you have not received your vaccines, we highly recommend you do so, but certainly do speak to your healthcare provider. Thank you again for watching. There is a church program that starts at 8 p.m., so please make sure that you do tune in for that program. And have a wonderful, wonderful evening. Take care. Bye-bye.